Thank you very much for that. My name is Dr. Bashir Isak. I am the head of the Department of Family Health from the Ministry of Health. We will request for an opening prayer by our bishop here, Bishop Warari. Please help us with the opening prayer. Santi. Mike? Or is mic'd?
Our Father and our God, we come before your throne of grace this beautiful day, thanking you for keeping us alive, providing for us, and giving us an opportunity that we can meet together so that we can deliberate matters that touches on your creation. We welcome you in this short meeting that we will have. We pray for wisdom. We pray, Lord, that the results that we may conclude, that they will find their way so that the mother and child can live to their fullest and that they can enjoy good health. So we welcome your presence. Indeed, we remember the children that are suffering, those who are sick, those in need, as well as our women, whatever they are going through, that your hand will touch them and do them good. We realize that we are in this era of COVID-19, and gracious God, it's our prayer that you're going to grant us your mercy so that there will be a quick solution, and that those who are affected and infected, you heal them and bless them and walk with them. So we ask that you begin with us and end with us. For this we have prayed in Jesus' name. Amen.
Thank you very much, Bishop, for that word of prayer. Allow me to recognize our chief guest, Dr. Rashid Aman, Chief Administrative Secretary, Minister of Health, Madam Maureen Baka, Chief Administrative Secretary, ICT, Chair of the CEC, Dr. Joseph Mbai, Director General NCPD, Dr. Mohamed Sheikh, Dr. Andrew Mulwa, Director for Preventive and Promotive, Minister of Health, Bishop Warari from Interreligious Council of Kenya, Dr. Aziz Geldi, Deputy Country Rep for UNFPA, Ms. Lillian Mutea from USID Fraternity, and all partners who have participated in this and supporting us in this agenda, Minister of Health staff who have been planning all this activity, and the fourth state. Good morning. I think my program has come to an end. I will hand over this next session where we will make our remarks to Dr. Andrew Mulwa, the Director for Preventive and Promotive, Minister of Health, to take over. Asanteni.
Thank you very much, Dr. Bashir. Our chief guest, the Cabinet Administrative Secretary in the Ministry of Health, Dr. Rashid Aman, the CS in the Ministry of ICT, Madam Maureen Baka, the Chair of the CECs for Health Caucus, Dr. Joseph Mbai, Dr. Sheikh, the DG National Population Council, our Bishop, Bishop Warari of the Interreligious Council, UNFPA representatives and the Deputy Country Rep, Dr. Aziz Geldi, USID representative Lillian Mutea, all distinguished guests, ladies and gentlemen, members of the Fourth Estate, good morning. I know it's a Sunday, and Sunday is a worship day for most of us. And number two, Sunday is a rest day for all of us. And therefore, today's event comes as a disruption to most of us in the sense that being a weekend, there is somewhere else where you could have been. I want to take this opportunity to thank all of you for joining us today to celebrate with the rest of the World Contraceptive Day for the year 2021. There are a number of us who are following us virtually, and we also want to appreciate them for taking their time to join us. In many counties, in a lot of counties, similar celebrations are ongoing. Some of the counties have pushed back the celebration to last week, and others will be celebrating tomorrow. So therefore, this is an event that is the national celebration, while we know that the county celebrations are ongoing. My sincere gratitude to our partners who have made this possible, this celebration possible, and more so our staff working in the Ministry of Health, who have put in a lot of effort to ensure that today's event is a success. Without much ado, I will be inviting various speakers. My duty is very simple: to invite speakers to make remarks on this important day. I think before I invite some, I want to remind him that in my previous portfolio, we engaged very much. And when Sam was making a case for contraceptive use or family planning in Makueni County, he met the members of the county assemblies. He met the CECs for health. He actually met the cabinet, the governor, everyone, to demonstrate that the conversation around contraceptives is not just for the healthcare workers or in the health sector. It needs to involve everyone who is involved in decision making at the national, sub-national, and even at the household level. So allow me to invite Sam Mulanga to make remarks on behalf of AFP. Karibu sana Sam.
Thank you very much, Dr. Mulwa. Our chief guest, CS Minister of Health, Dr. Rashid, CS ICT, Madam Maureen Baka, Chair of the CCs, within the COG, Dr. Mbai, our Director General, NCPD, Dr. Sheikh, development partners represented here by USAID, Madam Lillian Mutea, UNFPA, Dr. Aziz. Our partners, the many members of the civil society that are either online or here, the Interreligious Council and the media. This is indeed an important day. And just carrying over from where Dr. Mulwa left, what he did mention, that county where he said he came from, Makueni, and of course he had many hats, also as the chair of the CCs, it ended up enacting a Family Planning Act. And in that Family Planning Act, 1.5% of the annual health budget of the county was to go towards family planning and reproductive health. That is a way of sustaining family planning at subnational level. And how happy we are that Kenya, this very country, was the first country in sub-Saharan Africa to acknowledge family planning as a major program. So it became the first country to start the family planning program in sub-Saharan Africa. And as statisticians will say, we have moved a long way from that time in 1967 to this day. It is also great that family planning not only had a home in the Ministry of Health, but also got a home in the Ministry of Planning, or at that time, as it was called, Development and Planning. It was the wisdom of the actors at that time in government to see that family planning is not only a health issue, but a development issue. And as acknowledged by the then Minister of Finance in 1974, who later became our president, Mwai Kibaki, that you cannot plan for a country without planning for a most important factor of production, and that's human beings. And that's why family planning becomes very important, not only in matters health, but in matters development. And therefore today, having moved from a contraceptive prevalence that was way below to now enjoying a prevalence that is in the 60s, is to acknowledge the great role done by government, the partners, the development partners, and the common mwananchi to move the needle. How happy we are in 2019 when the President, His Excellency Uhuru Kenyatta, said during the International Conference on Population and Development that we now need zero unmet need for family planning for Kenya. Zero unmet need. In other words, anybody who desires to plan actually gets access to family planning. And therefore, with that background, it is the challenge to all of us to actually get there to zero unmet need. And that's the challenge that I want us to continue interrogating as we move forward in this journey of family planning, and as we celebrate this day, the World Contraceptive Day. Thank you so much, Dr. Muller.
Thank you very much, Sam. Let's kindly give him a round of applause for the passion, reminding us the journey, and also telling us where we are, and His Excellency's commitment to zero unmet needs of family planning in our republic. Thank you very much, Sam, for the work that you continue to do for this country in the contraceptive space. My next guest will be my teacher, a man that I knew the first day I entered the University of Nairobi, not very many years ago, but not yesterday. A man who has worked in the reproductive health space, in adolescent health for a long time, working together with the counties and the national government to ensure that we deliver holistic reproductive health services to our people. This is none other than Professor Gishagi, who I now kindly ask you to applaud as he comes to the podium. Karibu, Professor.
Thank you, Dr. Murwa, for the kind introduction. All protocols observed. I would like to acknowledge the invitation from the organizers of this meeting to talk about where we are in terms of commitment and our findings in terms of how much the needle has moved since we committed ourselves in 2020 to the call to address unmet need for family planning. Globally at that time, about 500,000 women, 240 million women had unmet need for family planning, and FP 2020 committed itself to reduce that by 50%, to increase the number of users by about 120 million. And Kenya committed itself to increase the CPR, contraceptive prevalence rate, from what it was to about 53%. And the good thing is to note that Kenya has continually and sustained the gains and has met the commitment in terms of family planning. Just to note that in 2014, about 53% of women of reproductive age, age 15 to 45 years, were using a method. And that data is confirmed by the Demographic and Health Survey, as well as PMA, Performance Monitoring for Action project, implemented by International Center for Reproductive Health, Kenya. In 2020, the CPR is about 61%. Really, a lot of growth over that period of time. But how do we interpret that number? It is important for us to note that a national point estimate hides or cannot tell you the differentials in terms of different counties having different coverage. And that is important to think about, because as you think about the theme of this meeting, no one is being left behind in the era of COVID-19, it is important to figure out 61% is good performance at a country level, but is it good performance at individual county levels? And that is an important question to answer when you look at no one is being left behind. And what is going to help you to determine that particular intervention? Quality data. And PMA has been providing data point estimates since 2014, and will continue to do so. But PMA is not alone. We have Kenya Health Information System, a system I've seen grow and improve, and the quality of the data therein is impressive. And over time, it is my prayer that we continue to improve what is captured under Kenya Health Information System, so that we do reduce the need for surveys. And in case in point, for those of us who have been in the field long enough, we used to do PMTCT surveillance, sentinel surveillance. Today we don't do it. Why? Because the routine data helps us to be able to determine what we could have done with sentinel surveillance. My prayer is that one day, Kenya Health Information System would have matured to that point where surveys become less important. But just to let you know that we do find women who are being left behind. And this is important to think about. Who are these women? Adolescent, young women. We have poor women, women from the rural areas, women with low education. Certainly, data is telling us these individuals are being left behind. But of note, is the progress made even for those sectors by government? Because if you look at the disparities, the gaps are becoming smaller. That means the interventions being put in place are bearing fruit, but we still need to go an extra mile to be able to reach and ensure that every woman has not been left behind and they are able to get the services they require. Our family planning program has been performing very well. Demand has flattened, but we know demand satisfied by modern contraceptive has increased, and we have been performing nationally at about 80%. That tells you if a woman got for services, the kind of methods she is able to receive are those which then are going to protect her for a long time. And so to encourage partners and government to continue investing and being guided by data, which then is going to inform targeted interventions, which then will eventually ensure none of our women is left behind. And therefore, data is central. Data which is very viable is central to be able to achieve and track the things you need to look at. The zero unmet need, how can you know you are getting there? Is by having high quality data. And we'll continue to invest in those kind of data platforms so that we ensure that government is constantly being informed by data which is high quality and therefore can track. So as we celebrate this day, let's again think about the value of data for decision making, and let our decisions be guided by that kind of data. I appreciate for the opportunity and for listening to me. I thank you.
Thank you, Prof, for those remarks, reminding us of the global unmet need for contraceptive and the milestones that we have done as a country in improving the CPR, and emphasizing the value of data in our programming. And thank you very much. Allow me to now invite our next speaker, who represents the private sector, which plays a very critical role. Of course, the COVID-19 has taught us very, very valuable lessons in terms of the global supply chain, which is important in ensuring that we develop systems, country systems that can be able to guarantee supply of essential goods and services even when there is disruptions like COVID has done. I now invite Mildred Peter from Bayer to make remarks. Karibu Mildred. Tumpigieni makofi jameni.
Thank you. To the CES from the Ministry of Health, Dr. Rashid. The CES from the Ministry of ICT, Dr. Maureen Mbaka. I also acknowledge the presence of Dr. Mahmoud Sheikh, the DG for NCPD. I acknowledge the presence of Dr. Bashir and his team. I acknowledge the presence of Mr. Mbaye from the Council of Governors, as he sits as the chair of the CES Health, Dr. Aziz, Deputy Country Representative of UNFPA, and Dr. Lillian Mutea, representing USAID, and all the partners present here today. Ladies and gentlemen, it is an honor really for me to stand here and speak on behalf of the private sector, which continues to play a huge role and an important role in supporting the government and the people of Kenya in making sure that there is access to family planning, which is not only limited to products, because we also need products, but also interventions in education, interventions in system strengthening, interventions in capacity building and knowledge transfer in Kenya. Through the strength of partnerships, the private sector, if I may say, has been able to reach with partners, with NGOs, whether international or local, reach countless communities with behavioral change communication packages, and have continued to partner with government in making sure that we deliver affordable contraceptives to millions of women and teenagers, helping to keep them in education, in employment, and in training where these are available. I am one person who strongly believes personally that the future of Africa is tied to the future of women. These women each day, whose hands keep rocking the cradle, and they are shaping the destinies of nations and shaping the destinies of countries, that our interventions continue to focus, because we strongly believe that family planning and access to contraceptives plays really a huge role in empowering women. And for us as a company, even Bayer, we have taken a commitment to make sure that 100 million women in low and middle income countries have access to modern day contraceptives. We're partnering with the Gates Foundation, we're partnering with international and local NGOs across sub-Saharan Africa to ensure that access is reached. There are still millions and millions of women who need access, and we strongly believe that information and education is a tool that would encourage uptake of family planning. We will continue to stand and support the people of Kenya as the private sector to ensure that the focus that government is giving in making sure that no one is left behind, that we support this cause and we will continue to stand with you and continue to make sure that access is given to women, access is given to girls. We want our girls to stay in school because we know that they can change the world. Once more, thank you so much for making us part of this conversation, for making us part of these partnerships. Thank you and happy World Contraception Day.
Thank you very much, Maureen, for your comments. Indeed, the future of Africa is tied to the future of women. And stating your commitment, Bayer, to reach 100 million women in low-income economies accessing family planning products. Then the importance of information and education to women to increase the uptake of this. Thank you very much. Can we applaud her once more? I now move to invite our development partners. UNFPA have been playing a very, very important role in delivery of family planning services in this republic for as long as I remember. And we have had very cordial partnership with UNFPA, the Ministry of Health, and now with Devolved Health, the counties, to ensure that our women, our healthcare workers, our governments are able to have the commodities, trainings, capacity building of healthcare workers, and even reaching the communities through UNFPA. It's now my humble pleasure to invite Dr. Aziz Geldi to make remarks on behalf of UNFPA. Dr. Aziz is the Deputy County Representative, UNFPA in Kenya. Karibu, Daktari.
Thanks a lot. Dr. Rashid Aman, CAS Minister of Health, Ms. Maureen, CAS ICT, Dr. Sheikh, DG NCPD, Dr. Mbai, Chair of CCC Health, Sister Lillian, USAID, Ms. Milfred, Private Sector Representative, all colleagues, ladies and gentlemen, good morning. This is great pleasure for me to represent UNFPA team today with you when we are celebrating World Contraception Day today. By being here together and who is online, we are one more time showing our dedication to the family planning program in order to save lives, as already we told about it, and also to go beyond of health implication of family planning. We are, by dedicating ourselves, we want to give opportunity to girls to continue their education. By dedicating ourselves to family planning, we want to give to women to work in businesses, to show, be with us, with men together, and make Kenya one of the brilliant country in the worldwide. And already my Sam and Professor underlined what I wanted to tell, but here I want one more time note with appreciation that Kenya made significant progress in family planning, particularly if I will take two indicators what Professor already mentioned. One is contraceptive prevalence rate. If 23 it was around 39, 2020 we are talking about 61% in Kenya, nationwide. Of course, if we will go subnational, as Professor already underlined, we will have different pictures. Also, on the demand satisfied for family planning methods, Now Kenya reached the global standard. This is about 76% in 2020. And what is good, one more time I want to underline that Kenya is putting development and population program, making it people-centric. And this is very aligned with the spirit of, now we are everywhere saying in the worldwide Nairobi Summit, ICPD 25 Summit, where we one more time came back what we promised in 1994 in Cairo, in Egypt. And Kenya made very clearly 17 national commitments where we can see universal health coverage, ending of FGM and harmful practices against women and girls, family planning, and already, as Professor mentioned, one of the commitment was having reliable data in order making decisions based on evidence. That is commitment, and in this commitment, we are working together how to achieve it. Last year, NCPD produced already the first report. This year, we will have second report, how we are moving with the implementation of those 17 national commitments. Of course, COVID-19 put globally and also in Kenya a lot of challenges to implement our commitments, our promises to our women and girls. But here in Kenya, we found and we are finding how to work another way, and this is good. Today we have ICT, CAS, by having innovations, moving to the digitalization of our paperwork, how to reach to our beneficiaries remotely, giving them right and full package of information about family planning. And I like that today we, at the beginning, putting family planning out of health sector. This is really a good example. If we will concentrate and give this issue only to Ministry of Health, it will be wrong. Family planning, if I can say in my English, I can see it as a game changer or accelerator to achieving of almost whole 17 SDGs, because it is contributing very strongly if we will do it on right way. And here, of course, first of all, we should have predictable financing at the national as well as country level of family planning program. And having financing and also procuring commodities, it is not solving problem. Again, we should go comprehensively, multi-sectoral approach, giving the right information to all our beneficiaries, as well as also reach last mile without any interruption of supply chain management. By being together on Sunday here physically and online there, by dedicating ourselves, I am sure we will do it in Kenya together. And as a long partner, efficient partner, UNFPA, we are one more time committing that we will work together with the government of Kenya, all our partners, and particularly women and girls of Kenya, in order to make that family planning will be as we are going to the supermarket. What I want to get, I will get it, in good quality, in time, and we will have wealthy nation and healthy nation. Thanks a lot. All the best. Have a nice Sunday.
Thank you very much, Dr. Aziz, for your remarks. Of course, reminding us of the milestone again that we have made in uptake of family planning products in this country, and our commitment as a country in the ICPD 25. and also bringing out the issue of ICT and technology in delivery of services and reaching the younger generation, and reminding us that family planning will accelerate the attainment of the 17 SDG goals as they are. Now, it's my humble pleasure to invite Madam Lilian Mutea, representative. Okay, I will recognize Lilian Mutea, who is representing the USAID. She will not make remarks, but we recognize the partnership between the USAID and the Ministry of Health and the Republic of Kenya in delivery of health and other services in this republic. Kenya and USAID have had a long-standing cordial relationship that has fostered development in all aspects in this republic. I now want to invite the last speaker before we break to a panel session, Dr. Mohammed Sheikh, who a few months ago, months, was in the position that I am in, but now he comes in as the Director General of the National Population Council to make his remarks. Karibu Daktari.
Thank you, Dr. Mulwa. Our chief guest, thank you. Our chief guest, the Chief Administrative Secretary, Minister of Health, Dr. Rashid Aman, the Chief Administrative Secretary, the Minister of ICT and Innovations and Youth Affairs, Morin Baka, Dr. Joseph Mbai, who is the chair of the CC's Health, my friend from UNFPA, Dr. Aziz, and also my friend from USA, Dr. Lily. The media, the government, staffs present here, our partners, the private sector, good morning. Distinguished guests, ladies and gentlemen, I'm delighted to join you today as we mark the World Contraception Day 2021. We mark this important occasion amidst the COVID-19 pandemic, which we are all aware has changed the way of doing things. I'm however happy that we have adopted to the new normal while leveraging on technology for posterity. This is a critical time to ensure that our population is safe and the most vulnerable among us are protected, especially our women and girls. Our chief guest, the theme of the World Contraception Day is leaving no one behind, expanding sustainable access to contraceptives in the COVID-19 pandemic and beyond. This theme will not have come at a better time like now. It is a time key players in this space stepped up awareness creation and continually educate the public on the important role that family planning plays as a key component in the development agenda of our nation. We must also remain committed to this goal to ensure that we close the gap on the zeros at such moment, the zero maternal mortality, the zero gender-based violence, and zero unmet need for family planning. Our chief guest, I wish to underscore the National Council for Population and Development continues to create awareness on population and development issues in Kenya as stipulated in our mandate. And more specifically, we continue to high-level advocacy to ensure that political commitments toward increasing funding for family planning program in Kenya was specifically built a sustained knowledge on sharing campaign over time to reduce and debunk the myths and the misconception while increasing family planning uptake. Our chief guest, we know that over the year, the government of Kenya has continued to increase the funding to family planning program, and this will over time be fully domestically funded, where the current domestic financing is around 50%. Annually, our chief guest, as you are aware, we need more than 2.1 billion Kenya shillings for family planning funding, And I know progressively we have increased this funding. This year, I think, our funding is over 1 billion. With the support of our partners, USAID, UNFPA, DFID, and World Bank, and others, I'm sure we'll be able to fulfill that commitment of funding our program fully. Our chief guest will remain upbeat that attaining the universal health coverage milestones be key in meeting the unmet need for family planning in Kenya. Ladies and gentlemen, I will not overemphasize the essence of contraception, but allow me to note that it prevents pregnancy-related health risks for women, especially adolescents aged 15 to 19 years. These young adolescent women must not be left behind. They must get good education to realize their potential. This, in turn, will help Kenyans reap the demographic dividend. Our chief guest, as you are aware, Kenya is in what we call a demographic transition. We are moving from a population of a childhood-based or children-based population to an adolescent-based population. Or 75% of our population today is below the age of 35 years, 75%. And this kind of demographic shift will continue for a while. For the next 50 years, Kenya will have a very youthful population. And when you have a very youthful population, it's a population that's really very dynamic. It's a population that's very eager. It's a population that needs to be engaged. And it's very important as a country, we need to harness these demographic dividends and this shift. Because this is just one time, lifetime for any nation. If you look at mostly the Asian tigers, this is the time, they invested in their youth. And that's why you can see now countries like Malaysia, Singapore are already, developed. And one time they were at the same level, with Kenya in terms of economic development. But because they invested in their youth, and that's why they are where they are today. So what we are saying, this time and this era, we need to invest in the potential of our youth. Our chief guest, Kenya total fertility rate has dropped in the last decade from 4.6 to 3.4% per woman between 2009 and 2020. There are notable variations among counties. Some counties such as Kirinyaga reported low number of births per woman or reproductive age. Women in northern region reported high birth rates of up to 5 per woman. These variations are also notable in the uptake of family planning service, where Kirinyaga County leads the modern contraceptive prevalence rate, MCPR, at 77.5 among married women, where in Mandera, the county with MCPR is 7.3%, while the national rate is around 61%. Contraceptive prevalence rate was 68 for all methods, and demand satisfaction is at 77%. These figures were also given by Professor Gichangi from the PMA program. A reduction in fertility provides an opportunity for accelerated economic growth, and therefore there is need to support the counties with high fertility and low MCPR to improve these indicators. As I conclude, our chief guest, I take note that during the 4th National Leaders Conference on Population and Development in May 2021, we hosted the National Leaders Conference on Population and Development here in this hotel, Serena, in May this year, and key recommendations by the delegates, and at the top of those recommendations was a call to advocate for the implementation of the Abuja Declaration commitment to allocate 15% of the national budget to the health sector for sustainable purpose. As you are aware, even in the ICPD commitment, one of our commitments was to increase funding for health. At the moment, I know we're not doing very well, but at least we have progressively increased funding for health. But what we're saying is that we need to increase funding for health, in particular for family planning, because family planning, we consider it as a developmental agenda, and it should be part and parcel of our development programming. Chief guest, allow me to reiterate that NCPD continues to play its rightful role and will work hand in hand with the Ministry of Health, the Division of Reproductive Health and Maternal Health, and other government agencies in advocating for family planning. Our chief guest, with this improved funding for family planning with our partners here, it is important now we focus on what we call advocacy and demand creation. We may have the commodities in our facilities, but the awareness and the information is very important for the citizenry of our country to know what commodities are appropriate for specific clients. So with those few remarks, Chair and Chief Guest, I want to say thank you very much, and may God bless you.
Thank you very much. With concurrence of the chief guests, I am about to change the program a bit. We finish up with the remarks, then we go to the panel discussion, then close the function. So while in the program, we at this time are supposed to break for the panel session, I will invite Dr. Mbai, the chair of the CECs for Health Caucus, my successor. And they always say, when your successor succeeds, you have succeeded. Dr. Mbai, I am not talking about myself, but you have succeeded, and therefore I have succeeded. Karibu on behalf of the Council of Governors and the CECs for Health to make remarks. Then invite the other guests appropriately. Thank you very much. That is the end of my emceeing. Asanteni.
Thank you very much, Dr. Mulwa. Our chief guest, Dr. Rashid Aman, all protocols observed. I must say that I'm very delighted to be here this morning to be part of this discussion as we celebrate the World Contraceptive Day. And as a chair of the CC Caucus, I also sit in Council of Governors, and the chair of our Health Committee in Council of Governors is the Governor of Kisumu, His Excellency Professor Anyang' Nyong'o. And I have seen one of our COG members, Mebo. Mebo, just say hi. Good. I must say that in the counties where the people who are using the contraceptives are, we are committed as governments to make sure that every mother who requires to plan the size of the family together with their partner is taken care of. And we've had quite some challenges that as government we must make a decision on how to deal with, especially the issue of commodities. FP commodities have been a serious challenge in the counties, and I would want to recommend that as a government, with the team of Dr. Sheikh and Dr. Kaleti, as we develop the policy for family planning, we really need to ensure that we have a robust way of making sure that the FP commodities are available for every person and in the right mix. We also need to deal with the issue of skills. Majority of our healthcare workers have not been trained well in some of the family planning applications. And as we in the counties work every day dealing with those mothers as they come, we really need that support all the time. And when we talk about unmet need for family planning, we know that 18% of our Kenyan married women are not on constant family planning methods, which is a big challenge into improving the contraceptive uptake. So the issue of commodities and the issue of skills is very critical. We have some other barriers like cultural and religious beliefs, and also attitude of some of healthcare workers, and we would want to recommend that because health is a devolved function, we really need political goodwill to support the family planning program. And I want to say that a good example has been set by Dr. Mulwa in Makueni, where they have an act. And I think as Council of Governors, we really need to encourage the counties also to start budgeting for that by involving the county assemblies to make sure that some budget lines are actually put to manage the area of family planning. I must say that as counties, we have been also looking at the issue of teenage pregnancies, and we've realized that when teenagers become pregnant at early age of 10, 15, 16, 18, we've also been asking ourselves, what is the way forward in terms of making sure that if a girl of 13 years comes and gets pregnant, the policy guideline there is not very clear whether you want to give them family planning, and when you look at the presidential directive of whether you want to give family planning to children or not, then as a nation, we get at a loss. So that's another area where we really need to look at as a nation so that we are able to deal with the issue of teenage pregnancies, to make sure that every time when they come and they have children, we don't let them continue getting more children. I know there's a discussion we had with Dr. Sheikh about if we really want to achieve demographic dividends as a country, we must deal with the issue of teenage pregnancies very seriously. And as we celebrate this day, we also need to ask ourselves as a nation, do we really continue depending on donor-funded programs as far as FP commodities are concerned? Or do we, as a government, make a decision to fund that so that we can get the right mix for our women and also make sure that the issue of stockouts is not there? So as I finish, I really want to emphasize on that area of commodities availability, because COVID pandemic has really changed the way we are managing our health systems, and it will be very necessary for us as government to make sure that we allocate monies to get these commodities so that even if we are getting donor funds, that one can be supplemental. But we must commit ourselves as a government to make sure that we provide those FP commodities to our people. And the other thing that I would recommend is, during the COVID time, we've noted that digital platforms have really worked very well in terms of making people get the information they want. We've done a lot of Zoom meetings, and we can use those platforms also to educate our youth, to educate young couples who want to use family planning to space their kids. And when we cannot be able to get them physically, the digital platforms can really help. And I wanted to finish with that point of digital platforms as I invite the CAS of ICT, Madam Maureen Baker, to come and make her remarks. Until she comes, You clap until she comes. Thank you.
Colleague CIS, Dr. Rashid, CIS Health, colleagues from government, our development partners, UNFPA, USAID, ladies and gentlemen, good morning. My name is Maureen Baka, as stated. I'm glad to be here today, joining you as you observe the World Contraception Day on behalf of the Ministry of ICT, Innovation and Youth Affairs. I will be today joining the panel discussion, so I don't have remarks as such, but I will be speaking, of course, on, a lot has been said, of course, on digital innovation and what is the role of digital innovation and ICTs in really expanding the access to family planning, information, and services. As has been correctly stated, there are various applications, especially given that, as has been stated again, 75% of the population are young people, me included. So how can the youth use ICTs, use social media to spread information, spread information and share information on family planning? I'll also be speaking on access to family planning services. Of course, universal health coverage is one of the big four under the Big Four agenda as set out by His Excellency the President, the Honorable Uhuru Kenyatta. And to achieve the Big Four agenda, technology is recognized and continues to be critical in delivering the Big Four agenda. And of course, I'll be speaking on connectivity across the country. The government does continue to invest in connectivity so that there's universal access to the internet, of course, across the country. And this includes our hospitals. There has been, to date, connectivity to 18 level 4 hospitals under the UHC. And the ministry will also continue to deploy IP telephony when it comes to phase 2 of this program. So I will be speaking more on this when it comes to our panel discussion later on. So I will close here and call for the chief guest to give his keynote remarks. Dr. Rashid, Karibu. Thank you so much.
Thank you, Maureen, my fellow colleague. Distinguished presenters, ladies and gentlemen, good morning. Let me begin by saying that it has been said before that family planning is largely a female affair and that men are not too serious. And I ask you the question, if you look at this room today, I believe there are more men than women, yes. which I think sends a message home. But of course, I want to thank the Fourth Estate for contributing to this gender bias in this room. I'm very honored and pleased to join you today in commemorating the World Contraception Day 2021. This global event centers around family planning, vision where every pregnancy should be an intended pregnancy. World Contraception Day raises awareness of birth control and pushes for better education when it comes to sexual and reproductive health. This year, in addition to creating awareness, Kenya has chosen to focus on improving access to contraception for all. Contraception is a key component of sustainable development, empowering women, reducing the risk of maternal and child mortality, and promoting economic growth. This year's theme is therefore leaving no one behind, expanding sustainable access to contraceptives in the COVID-19 pandemic and beyond. In the past decade, Kenya has made tremendous advancements in increasing access to more modern methods of contraception. Data shows that the percentage of married women using modern methods of family planning has increased from 36% in 2007 to 61% currently. This has helped curb rapid population growth and drive development. With the COVID-19 pandemic upending lives across the world, accessing and making good decisions around contraception has become more challenging. Our statistics from the Kenya Health Information System show that for the financial year 2019-2020, family planning visits dropped to about 5 million visits from about 5.4 million visits the previous year. This, of course, can be attributed to several factors during this time of the COVID pandemic, including reduced hospital visits and loss of income due to the pandemic. In Kenya, the pandemic has exposed inequalities in access to contraception that need to be addressed. While contraception services have remained largely accessible to people in the high-income brackets, marginalized groups and persons living with disability have not been so lucky. A significant number of Kenyans lost their sources of livelihood due to COVID-19, and this has seen them prioritize the provision of basic needs for life and for their families as opposed to reproductive health care. Additionally, an even larger number of Kenyans in rural and remote areas were unable to make hospital visits either due to distance or to minimize the risk of contracting COVID-19. These inequalities pose a risk of reversing the progress Kenya has made in enabling access to modern contraception. Our theme today was largely influenced by the government's recognition of the unique circumstances brought about by COVID-19 and the need to highlight and address them to avert a future crisis. The Ministry of Health has put various efforts to strengthen our health systems, to overcome these challenges and improve availability of reproductive health, particularly family planning services across the country. Studies have shown that every dollar spent on family planning ends up saving $6 that can be invested in improving health outcomes of the mother and child. To increase public funding and reduce reliance on donors, the government and its development partners agreed on a formula that would have family planning fully financed domestically by 2024. I think we are all aware of this sustainability and self-reliance roadmap, but of course, we have also been hit by an unknown, which is the COVID-19 pandemic, and I'm certain that we will need to revise this roadmap in light of this pandemic. I am glad to report that for the financial year 2021-2022, the health budget increased from 111.7 billion to 121.1 billion shillings. This increase in funds will largely go towards universal health coverage, which also covers family planning services as one of the benefits that will be covered through this program of outcome-based insurance. Additionally, we are striving to ensure that postpartum family planning services get included as part of the free maternity or Mama Linda program. In the financial year 2020-2021, the government disbursed US dollars 5.1 million to family planning commodities against the allocated US dollars 7.9 million. In addition to that, contribution by development partners of US dollars 3 million. Yet, Kenya requires a total of US dollars 20 million to finance these strategic commodities. So we recognize that we are always challenged with facing a gap in meeting the resources that we require for family planning. World Contraception Day 2021 certainly brings to the fore the pressing need of attaining self-reliance with regard to financing family planning commodities. The Ministry of Health has undertaken to bridge the financing gap through a formidable transition plan. These efforts will see to the sustainability of family planning services in Kenya. In order to bridge this gap, the government and development partners agreed on a formula that would have family planning fully financed domestically by 2024, as stated earlier. It is important to note that the universal health coverage and the country's health benefit package, which the ministry has developed, will also enable provision of family planning services down to more accessible facility levels upon execution. Furthermore, the government commits itself to working hand in hand with all stakeholders in health and the allied sectors to ensure improved access to family planning services, being a component of reproductive health as enshrined in our Constitution of Kenya, 2010. Family planning commodities are strategic to the well-being of a country and our economy. We should not forget that men are key players in the conversation on family planning with a responsibility for the good of the family. On this World Contraceptive Day, our focus is to create awareness of its importance to women of reproductive age, clients, policymakers, leaders, and development partners. In the spirit of our theme, we welcome every stakeholder, particularly representatives of vulnerable and marginalized populations, to provide information and to avail themselves for discussions surrounding family planning towards progressively improving access for all. As I conclude, I would like to acknowledge our partner ministries, the Council of Governors and County Governments, our development partners, civil society organizations in the private sector, faith-based organizations, and all other stakeholders involved in planning this World Contraception Day celebrations. Let us all continue to work together to ensure that contraception is accessible for all during and beyond this COVID-19 pandemic. Thank you.
Thank you very much, our chief guest, for those remarks on behalf of the ministry, and thank you again for all our partners, all our guests who have made remarks. I think that marks the end of our speeches today. We will take a 9 minutes break. I mean, we will reconvene at 10:30. I have nothing with the 9. So we will break. Then when we come back for the next session, we will have a presentation from the Department of Family Health, then have the panel discussion and close up. Kindly, let's take the next 10 minutes, tea served. Let's take the next, now 8 minutes to take that. At exactly 11:30, we begin. And thank you very much, our guests, for gracing the occasion.
all organizations here. Planning lead in the Ministry of Health, where I currently am working. So I want to do a presentation, short, but it's about family planning in Kenya and what the Ministry of Health perspective may be and where we would want to go with family planning. And my presentation, I beg if you would allow, would take the nature of a small story of a person who, of course, the name I have put, and it's not a real story, but it's a story that helps Wangui, Achieng, Olo identify with family planning and see that it's actually a doable thing for the family, and that wherever you are, no matter how far, we are concerned for you and we are planning for you too. So can we get started? It's short, but I pray that our point gets across. So I've named my presentation Family Planning in Kenya, and we are going to start with a little story about a mother. Her name is Sabira, and she's married. She's married to Amal, and they have a little girl called Habibi. Habibi is 9 months and 2 days old. They would like to delay getting another baby. You know, Habibi is a bit of a handful. And Amal says they can't afford another baby. So you know what? Sabira needs to go to the health center. And the health center is not really close to home. It's a bit far. So Sabira, being a lady, a mom, a housekeeper, she's got a lot in her hands. And well, she says, I'll get there. I'll get there. I know I need family planning. I know I need something. I'm going to get there. But where is the time? So Sabira delays. And in the meantime, you know that she can't get pregnant. So here is where I want to pick up the Ministry of Health story. So Sabira's story is really similar to 17% of the women of reproductive age who have an unmet need for family planning. Many of them, it may not be intentional, especially because they know the importance of family planning. So they have many reasons, and the reasons can range from reasons based on the lady herself, her partner, the community around her, and even her environment. But you know what? As varied as these reasons are, they're leading to a cycle. And this is one of many self-propagating cycles. An example of such a cycle would be, you know what? There is an unintended pregnancy. And you know what Amal would say? But I said, we cannot afford. Then there's some distress in the family. And then you get health issues. Maybe physical, related, because nutrition will not be as strong as would be expected. And when mom is sick, baby is sick too. And you see this cycle continues. Sometimes it ends in death, unfortunately. But that said, there are other cycles that can result from this indecision or the fact that Sabira has delayed her decision. You could get sexually transmitted diseases. She could get them. And applying it to the other 17%, there could be a lot of family instability. There are growth issues because of nutrition. Then you have reduced capacity for the family to provide basic needs, because now it's baby 2, baby 3, baby 4. Then you have a cycle of poverty, and sometimes even family asset management related difficulties. You know, the land rows and everything, they come in too. Remember where we began. So then it becomes bigger, because now the country has more people to take care of, and the dependent population grows. Well, this is a time to tell you that Sabira and Amal's story has gone nationwide, and it has national importance. Well, our take today by being here is that these cycles need to be broken. And one of the ways we can break these cycles is by making sure that family planning is in this country, everyone knows about it, and everyone knows how to use it. So then we go into the definition of family planning. We may be assuming that we all know, but it's important that we understand that because of family planning, every family will be able to have the number of children that they want, no more, no less, as much as they can control. They'll be able to time when the children come. 2 years, 3 years, 5 years, 6 years. And then they'll be able to space the births. Baby number 1, 2020, baby number 2, 2025, baby number 10, 2030, if that's possible. So how can we achieve family planning? We do it through contraception. I would want to say that previously we had a lot of emphasis on the traditional methods. These include like the calendar method, you're counting your days and hoping that your fertility day is the one that you've come to avoid. Then you have like lactation. When the mom is exclusively breastfeeding, she will not be able to get pregnant. You could use that too, but it only lasts about 6 months. Then there is cervical mucus examination. It's simple enough, but can be a bit confusing. And that's why we are moving, like the arrow shows, towards modern contraceptive methods. Not disregarding where we came from, because that's the knowledge we base our modern contraceptive methods on. Today, we have about 6.321 million women who use modern contraceptive methods in Kenya. And this figure brings our modern contraception rate, MCPR, prevalence rate, to 61%. And as previously mentioned here by other speakers who I'm honored to stand in the same stage with, though encouraging, this number needs to grow. That's why we're here for World Contraception Day. So this year's World Contraception Day theme states that leaving no one behind, expanding sustainable access to contraceptives in the COVID-19 period and beyond. And I want to mention today that our priorities as a ministry are in tandem with this statement. And these priorities will continue to improve access for all, leaving no one behind. All persons are important, and they are within our radar regarding family planning. Thank you.
Thank you very much, Dr. Estella, for that storytelling presentation. And that's the reality in the country. Please give her Another applause. Better one. Thank you all. We are going to the second part of this session, which is our panel discussion. We have 4 of our panelists here today, and I have a raft of questions, one each, and they are at will on the length of time they want to take, so long as they can address the issue adequately. These are questions that we think we need to empower and increase the awareness of the public, and especially our fourth state, on the issues that you are grappling with. I'll start with a question on the National Treasury and Ministry of Planning, represented by Dr. Sheikh, the Director General for NCPD. I think you're all mic'd, and you can speak from where you are sitting at the comfort of your chair. So, Dr. Sheikh, the question reads, during the Nairobi summit of the ICPD 25, the government committed to progressively increase health sector financing to 15% of the total budget. I think that's the Abuja declaration. Similarly, they committed to increase domestic funding for FP commodities to eliminate unmet need for family planning, which is what Dr. Stella was just presenting. Currently, the government funds about 60% of the commodity needs in the country. How does the government of Kenya plan to further assure commodity security within this uncertain climate of donor funding and COVID-19 pandemic? Note that Kenya is now categorized as a low middle income country and will soon move to the next level. And you're also aware that partners have been supporting us for years on end, and now the pipeline is drying. With this agenda being very critical to our development agenda and our population management, how do we handle this, and how do we ensure that we can 100% fund our commodity security in family planning? Karibu Daktari.
Good. Thank you, Dr. Bashir. Again, good morning. Good afternoon. Let me just start first by introducing myself, Dr. Mohammed Sheikh, the Director General for NCPD. And in regard to this question, let me just start first by saying that the government of Kenya, through our Constitution, Chapter 4, has shown commitment in terms of reproductive health and health. Reproductive and health in general. In our Constitution, Chapter 4, it says, we are endeavoring to provide the highest standard of health, including reproductive health. So in that regard, progressively, starting from 2010, I think we have focused in investing in family planning. And why we are focused in family planning is because we consider, just from the presentation of Sabina there, we consider family planning as an integral part of our development agenda. Because if family is the smallest unit of our population, and that's why really where we need to invest, so that at least that family is healthy, skilled, educated, and economically viable, so that at least they can contribute to the major development of the nation. So since 2010, we have progressively improved in terms of family planning funding. Annually, at the moment, our country requires more than 2.1 billion Kenya shillings. That's around 20,000 US dollars. We have, I think, from the Ministry of Health and the National Treasury, we have allocated, if you look at the budget of last year and this year, more than $1 billion, including from domestic financing. That's over 60% of the funding requirement. And our plan is by 2024, family planning should be fully funded by the government of Kenya. But I know funding will never be fully, it will never be adequate. And in that regard, we are looking at ways, innovative ways, we're exploring innovative ways to, support or fund family planning, both through the national government or other methods. One of them is working with the private sector, our development partner. And in the private sector, what we are doing is that we are having what we call a program called Total Market Approach, where we are working very closely with the private sector to make sure that the services available at last mile, at the community level, at hard-to-reach places, so that the community pharmacies and the pharmacies, private pharmacies, are able to provide family planning at that level. And in this regard, we're also working very closely also with our development partners. As you heard from the statement of our chief guest here today, we have an agreement with our development partners where we are having a ratio in terms of family planning funding, where the government of Kenya will contribute certain amount, and then the development partners also contribute equal amounts, but gradually reduce their contributions, and by 2024, 2025, we will be fully funding this program. The other thing is also looking at ways of ring fencing the family planning program funding. Ring fencing, I mean, sometimes you may get the funds for this year because of the goodwill of a minister or a cabinet secretary or a PS, but probably it may change in the next year or the other years. So in that regard, we want to have a mechanism to ring fence funding for family planning. And here we are developing a policy to make sure that family planning is an integral part of our funding, both at the national level and at the county level. At the county level, why we fund family planning at the national level is because it's for the economic scale, in terms of procuring this. Because if we say we'll do it from 47 counties, that will be a bit challenging, and that's why we do it nationally. But at the county level also, we have what we call costed implementation plans, where we want the counties to put more resources in terms of training healthcare workers, because sometimes we may have the commodities in our facilities, but the skills of the healthcare workers sometimes may hamper in terms of providing those services. At the same time, also, we want the counties also to create awareness. And that's why NCPD comes in. NCPD is mandated to advocate for family planning, but creating awareness and change, and also change behavior in terms of, accessing these vital commodities. So we'll also be working with the communities through the county government and other agencies of the government to make sure that the users understand what kind of commodities are available and make the right choice, because sometimes they may just be given commodities because they don't have the right knowledge or they have not been informed. So, Dr. Bashir, with your question, I think we are trying to explore on other methods of funding and be innovative in our fundings, so that at least not only the government gives money, but at least work with partners, work with the private sector, and work with the county government to make sure that we have enough commodities in our facility. I hope I have exhausted it.
Thank you, Dr. Sheikh, for that elaborate response. Here, the agenda is just beyond government, bringing in the private sector, bringing other partners, so that we can move this commodity security, at least. My second question goes to Madam Maureen from CAS ICT. The young people are tech savvy, and a large proportion of them spend considerable time on social media platforms. For example, a study in 2019 showed that those aged between 21 to 35 years spend more than hours in a day on social media. How can we utilize technology to enhance access to family planning information and services, noting that the government committed to employ innovation and technology to ensure adolescents and youth attain the highest standards of health as quoted in the ICPT 25. Waziri Karibu.
Thank you. Thank you so much for that question. Indeed, Kenya does boast a large youth population, with 75% of the population being young people. And as stated, that indeed the youth are tech savvy, they are innovative, they are creative, and they do tend to take up tech and use tech more than other generations. We do spend quite a lot of time on social media. Of course, all the applications, be it YouTube, be it Twitter, we have Snapchat, we have TikTok. The youth do use this for entertainment, for information gathering, to learn. So we are using all these applications right now. And this, when it comes to enhancing access to family planning information and knowledge, is of course it's an opportunity, as social media can be used to communicate and to reach out to a large number of people as regards sexual reproductive health and family planning. We can use peer-to-peer communications, especially when it comes to young people communicating to each other, what exactly is family planning, what are the benefits. And of course, this will enhance creation and awareness, and we are able to also reach a large number of youth. And of course, in this regard, the government has recognized the role of connectivity, the role connectivity plays in regard to spread and access to information, and continues to invest in connectivity across the country to ensure universal access. When it comes to, especially to young people, as a government, through the Ministry of ICT, we do have across the various constituencies what we call constituency innovation hubs. These are youth empowerment centers, essentially, that are equipped with free devices and internet, and they enable youth access, the internet, the world of the internet. They are mainly for training the youth on working online, how you can earn online, but there are also youth empowerment centers where the youth can go and get this information, access connectivity, and get all this knowledge. And of course, with the access to the internet, there's of course the question of protection of our young people. What can they access online? Are they being exposed to all these dangers? But in that regard, of course, we have recognized that the more we uptake ICTs, there are all the, the other negative impacts that come in. But the government has put in place a robust legal and policy framework to ensure protection online. We do have the Data Protection Act in place. We do have the Data Commissioner's Office, and all of this is in place to ensure that your data online is protected. We also have the Computer Misuse and Cybercrimes Act, and this is, of course, to curb all these ills that come with online use, such as cyberbullying, all those that come with that. When it comes to access to the actual services, of course, as stated, we have universal health coverage as one of the Big Four under the Big Four agenda. And these are, of course, our developmental priorities right now. And to achieve the Big Four agenda, we do have technology being critical as a key pillar in achieving the agenda. The government does invest in connectivity across the country to enhance access to healthcare. And to date, connectivity to 18 level 4 hospitals under universal health coverage has been done countrywide by the Ministry of ICT, with deployment of IP telephony targeted for phase 2. And of course, this will enable us to harness ICT efficiencies in healthcare in applications such as telemedicine, data management, and resource sharing, including reaching out to people as regards family planning services. And of course, key to this is data management, as has been mentioned today, and analysis of data. I think this was mentioned by Dr. Aziz and also Dr. Gichangi on data management and making decisions based on data. And ICTs come in to increase our efficiencies when it comes to this. So I think that is my answer to this, and how the youth can use ICTs to enhance access to family planning resources and information. Thank you.
Thank you. Thank you, Waziri. Mic test. Thank you, Waziri, for that response. Yeah, we know the technology is a two-edged sword, but we want to use the right edge for our development, and without technology and innovations, I think we're not going far. Thank you for your time, and thank you for being available and your patience. It shows our partnership is very strong, and we will rely on you on accessing, on helping these youth, and soon the current youth will be elders like us, and we're also using technology. We're not youth, but we're also using technology. And hopefully the whole population from the young to the elderly will be tech savvy. My next question is to Dr. Mbaye, who is the chair for the CEC from the county government. Daktari, issues of supply chain. A strong supply chain system is critical in ensuring every woman receives reproductive health commodities, including contraceptives of choice, whenever and wherever she needs it. How can the Council of Governors support Kenya Medical Supplies Agency and the counties to ensure commodities reach the last mile? We were just having a chat over break, and it was touching on the same thing. So it touches you on daily basis. It touches the mother at the same time. So as a manager in this area and as a head of a whole devolved system of government, we want to know your voice on how we can utilize our strengths and our opportunities on ensuring the last mile reach. Thank you.
Thank you, Dr. Bashir. I also had another question on teenage pregnancy, so don't forget that. But I must say that as county governments, we have been drawing commodities from KEMSA. And one of the things that we've always insisted as counties is that KEMSA meets our order fill rates 100%. And ICT department actually can help in this so well that if they can put a program whereby when I'm seated in Muranga or Wajir, I'm able to know what commodity is in KEMSA, and I'm able to know whether it's out of stock or it's available, so that when I'm putting my order, I'll put my order knowing that I'll get that product. And I'm sure using ICT that is possible, because gurus in supply chain management can be able to make that possible. And then the other thing is that we have a very supportive act that was given, I think, in the year 2018, where KEMSA was actually made one of the main suppliers in the counties. But what we've been asking the counties is that because sometimes there are delayed disbursement of funds, you realize that counties have difficulty in paying in time. And once that happens, then it becomes difficult to get an order. If you owe them a lot of money and you are not paying, then Doc, it becomes an issue. They'll say that please make sure you pay that before we supply this. And there, in terms of ICT also, we can have a system that would probably give a red alert when it comes to the ceiling of how much money a certain county can draw. So that when you are in finance department, you are able to know if you don't pay this amount, your ceiling will be ending, and when the red alert is flagged, then you can't order anything. So that counties can have that visibility and they are able to buy. I know counties have also been clamoring for having another supplier other than KEMSA, so that when we find that there are no commodities in KEMSA, we are also able to buy from another place. And I think for that going forward, I know it's something that the ministry is looking at. I know KEMSA is undergoing a lot of reforms in terms of management, the structures and all that. And we also wanted as counties to be involved very much in those structures and even having representation, so that when there are challenges, we can move together as a country. So that is all I want to say about that, Dr. Bashir. I don't know whether you want me to deal with my last question so that Dr. Bashir was to ask me was, how do we prevent the surge in teenage pregnancies and child marriages? Now, this is a topic that is very dear to me, and one of the things that really annoys me, and I want everyone who is in this room to get out of that door annoyed, is that as a country, we have accepted it is normal for a child of 13 years to come to maternity and deliver and go home, and we say it is normal. I think time has come when we must start saying it is not normal for a 10-year-old, for a 13-year-old, for a 15-year-old to come to maternity and deliver. And the minute we say that, then we shall not be seeing even a minister coming to national television to tell us that we have had 400,000 children giving birth in a year, and 11,000 of them were not able to do exams because they were at home waiting to deliver. And we must deal with it as such. Then, number two, we must deal with the cases of defilement. Child abuse is against the law. As a country, we've also taken it as very normal that if a child is abused, especially by a relative, people will sit down and agree. In Muranga, I dealt with a case where a 13-year-old girl had been impregnated by a cousin. And families sat down and agreed that they settle it out of court. But when I followed it, I said, you know, this is defilement, and we shall deal with it as such. And that man finally was jailed for 20 years. So we really need to deal with defilement cases as defilement and stop sugarcoating them as family issues. Then we must also abolish retrogressive cultures where children are getting married. Like, we had a case in Kajiado of a 14-year-old girl who was married off. And the society, we have leadership there, we have children officers, we have chiefs, and they have all accepted that it is okay for a 14-year-old girl to be married. I think we must deal with that issue conclusively, because as long as we continue allowing children to become pregnant, in this country, we shall never achieve the indicator of maternal mortality. We shall never eliminate mother-to-child transmission of HIV, because even when those small girls get pregnant, first of all, they hide. So by the time they come for their first ANC visit, maybe they are 6-7 months, there is a missed opportunity. If they were HIV, you will never capture them. So eliminating mother-to-child transmission of HIV when we have teenage pregnancy will become a very serious thing. Then we also need to involve men, because when I have been dealing with cases of teenage pregnancies, I've noted in some instances where you find a man of 40 years, 60 years, has impregnated a girl of 13, 14. Right now I have a case of a 75-year-old man who is now in jail, who has impregnated a girl of 16 years who happens to be her granddaughter. So some of these things are very, very serious. And by involving men, I mean that we need to do a lot of awareness, education, tell men about what the Sexual Offences Act says, that they can go to jail if a girl is below 12 years, life imprisonment, 13 to 14, 15, 20 years imprisonment, 16 to 18, 15 years imprisonment. And we are making this awareness even to young boys so that they know. Because we have had cases where even a boy of 17 years has been jailed. I know you follow those cases in Meru. And then mentorship in schools. And here, I want to say that as a country, Doc, we have to make a decision whether we will introduce sex education. In Cuba, children are taught sex education from the age of 10. And if you look at their teenage pregnancy indicator, it's very low, meaning that children are taught, but we need to ask ourselves, what is the syllabus? What are we teaching the children? Who teaches? Is it the school, or is it people in health? Who develops the curriculum? Is it us in health? Those are things that as a country we must agree. But the minute we start burying our head in the sand and saying that children are not old enough to be taught sex, then we will be making a very serious mistake. The issue of dysfunctional families, you know, in Kenya nowadays, we have a lot of single families, we have families which are being brought up by grandparents, and we as a country, we also need to look at that societal setup and see how to deal with that, because children present in those families, most of them are the ones who are getting these teenage pregnancies. Then we need to do collaborative approach. When I've been dealing with cases of teenage pregnancies, I've noted that the police are very important, especially for you to win a case of defilement. You must have an investigative officer who is very thorough, who is able to keep documentation properly, to keep the files so that the case is not lost. And then you need also to work together with judiciary so that justice can be given. And also, the other area, and Bishop is here, is the church. You know, the church needs to actually emphasize on the issue of sex morality, because we realize that when you teach children about the ways of God when they are young, and the Bible says that they will never depart. And if they depart when they are old, then that responsibility is not on you. And I know Bishop can confirm that. So I want to say this to men as I conclude. If you cannot go to a shamba and pick a raw pawpaw and eat, or if you cannot slaughter a one-day-old chick and eat it, men, we must now start saying that even those small girls who are not ripe, we really need to protect them. And that is a message that I am very passionate about it. I am very sad when I find a girl coming to Muranga Level 5 Hospital to deliver at the age of 10. And then some of them get complications. In fact, I remember there is one we did total hysterectomy, meaning that that girl and the baby, because the baby was preterm, so he died. Then the girl has gone home without a uterus at the age of 10. So what is that now? And the man who was responsible was a 22-year-old young man. Though jailed for life, that's something that could have been prevented. So, men, that's your message. Thank you.
Thank you, Dr. Mbai, for those very passionate responses and lifetime experiences which you are sharing with the audiences here. The question is multifaceted. It's not just a health agenda, it's also a social agenda, it's a religious agenda. And therefore, I will also request Bishop to respond from the religious perspective. Where is the morality of our society? How do you salvage? How do you follow the books that God has sent us so that you can live like human beings and avoid such tragedies? So I'll allow you also to respond to the same questions, but also allow me to ask the second question for you. Religion has been a major contributor to the health and well-being of families. The religious community have a great influence on some of the decisions made by couples on utilization of reproductive health services, particularly family planning. What role can the religious leaders play to enhance utilization of birth spacing interventions and to enhance health of women and their children? Welcome, Bishop Warari.
Thank you very much, Dr. Isaac. I would like to begin by visiting again the Sabira story by our sister doctor. And the question was, how do we break the cycle of misery? In the Bible, there is a text that is found in 3rd epistle of John, verse 2. And this is what it says. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prospers. So, in our religious circle, there is this desire that everyone may prosper, and then especially our mothers and children, and be in good health. And so we would do anything. We will go to any length, we will spend anything to see that our mothers and our children are well catered for. When I came early this morning, Dr. Isaac, I felt, because looking around, I'm the only religious leader. I felt that the Ministry of Health could have done more in follow-up to have a little larger number of religious leaders here. And the reason I'm saying this is because we all know that religious leaders, they have a very important role to play in the society. And a research done 2019 showed that the confidence level of religious leaders is only second to that of the Kenya Defense Force. So, and we all know that out of 10 people in Kenya, 8 belongs to a particular faith. So faith and faith leaders are very important, and they ought to be here. And I'm glad to say that religious leaders are now more informed than in the former years. We are more informed about our women's reproductive health. We are, for sure. And the well-being of the health of the mother and child. Coming to the role of the religious leaders, because religious leaders are bold and they have faith, we will work more in strengthening institutions that are catering for the health of the mother and child. Institutions like the hospitals, and we are all aware that over 40% of health providers, actually 44%, are from faith institutions. We will also come up, and we have hope messaging, where we have messages that give hope. And we also offer safe spaces. These safe spaces are where we have rescue centers, and where there are safe spaces where partners, both wife and the husband, can come and talk on issues of contraceptives, etc. Then also our role is that of capacity building and empowerment. Religious leaders also are involved in research and knowledge. Our role also is that of shepherding. We have what we call the ministry of presence. When a girl is raped, the parents or the guardians, they run to the shepherds and to the religious leaders. Dr. as you spoke about, of that 10-year-old girl, we are called and we witness a lot of critical situations, and we are there. We are there when a child is raped. We are there when they are violently abused. And so the religious leaders are offering the ministry of presence, chaplaincy, walking with all. Even the the villain, that particular person who has abused that child, he or she needs somebody to work with. And that is the role of religious leaders. Religious leaders are influential, and this gives us an opportunity to lobby for legislations that would be beneficial to mother and child, policies that have been crafted, call to actions or to action, we are aware, of course, that it has been said that one of the impediments to the uptake of contraceptives usage is religious beliefs. That is a gap that is there, and we may not deny it. But as I said, we are more informed, and we have been looking at those gaps, the myths, of course, part of which you, the medics or the health fraternity, you know, it said that why people don't use contraceptives is because they fear side effects. And of course, we are very well placed in trying to dispel these myths so that we can give proper knowledge about the contraceptive methods. We can create that platform. You who are professionals, you'd come to our congregants and share, and I think that will help us. So I wanted also to mention that I'm from Interreligious Council of Kenya. I sit at the executive board, and please kindly receive the greetings of our national chair, that is Reverend Father Mutie. The Interreligious Council of Kenya is a coalition of all major faith communities in Kenya that works together to deepen interfaith dialogue and collaboration among members of, for common endeavor to mobilize the unique moral and social resources of religious peoples and address shared concerns. So, in Interreligious Council of Kenya, we have standing commissions, and one of which is health. And we also have women of faith. And that docket, of course, really handles very well about the issue of contraceptives and the health of the mother and child. Because of time, allow me to go to the other questions. How do we prevent the surge in teenage pregnancy and child marriage? I remember one time I was interviewed by one of the national media houses. And the question that was posed was that religious leaders have failed to curb teenage pregnancy. And my answer was what Daktari has said. This is not time for blame game, because it's a collaborative approach. We need collaborative approach where religious leaders are involved, the Fourth Estate is involved, the government, the Ministry of Health, and so ours as religious leaders, our work is that of shepherding. So, and we have Sunday schools and madrasas where we continue teaching issues of morals and ethics to both the children and the adults, so that, and again, we would like to amplify our prophetic voice to come up with the stricter consequences, not just a slap on the hand where people do atrocities. And this reminds me, there was a draft bill by Madam Judge Mombi Ndongo, a sex bill. Although it did not see the light of day, and it was very strict because it was speaking about, among many other things, things like chemical castrations. Now men are awake. Yeah, now the religious leaders also, through their institutions, we have rescue centers where those who are affected can run to, like victims of GBV and all that. We have been advocating also that we should keep the girl child in school. If by any chance she gets pregnant after delivery, we'd want that girl to continue with studies, and all her needs should be met. Then, of course, I spoke about the collaborative approach, and we said this time there is no blame game. If there has been spiked underage pregnancies, I usually give an example. If you, in your house, you discover there is a snake, and it's a poisonous snake, what do? You don't start blaming each other who left the door open or the window. What you do is you come together and get rid of the snake, and then thereafter you can make, you can have a discussion. So we also, in the religious circles, we have zero tolerance to child marriages. We are doing everything possible. We are having, in fact, we came up with a child protection policy last year. And among the many things is that let the child be a child. Let the child enjoy that age of being a child. So we of course, from the religious sector, we are able, in our hope messaging, to dispel myths that hinder the uptake of contraceptives. And of course, we do this knowing that in the Interreligious Council of Kenya, we respect other people's opinion, and what we do is we have what we call win-win approach. With those few remarks, thank you, Dr. Isaac.
Thank you, Bishop. That was really very encouraging and very elaborate. The partnership with the church and with the Interreligious Council of Kenya is very glaring, and we hope to walk the talk. Allow us, this is a hybrid celebration where many of our partners are also online since morning, and we would like to read a few of the contributions from the online colleagues, and I'll allow Dr. Estella to read one or two or three comments. Thank you.
Thank you so much, Dr. Bashir. We want to acknowledge the online presence of participants for this World Contraception Day celebration. And we want to say that your opinions are being taken in, but the ones I'm going to read are few because we have received quite a number of inputs from you over Facebook, Twitter, and the like, social media. So we want to say asante sana for your participation, and that your views are being taken down towards taking action with them. But I'll read a few. So there's one that says, thank you to our Director General for highlighting a key component hindering service provision, in brackets skill gaps. There is need to urgently address this so that when commodities are available, the client goes home served at her service delivery point without issues of referrals. Thank you for that one. Another one, a clear roadmap should be in place for advocacy efforts so as to be all-inclusive. My bias is towards minority populations and street families. Again, a really important issue. Thank you for that input. Another is, as a provider, we still don't have a clear guideline on whether to give adolescents contraceptives without the consent of parents or guardians. Remember, they form a big percentage among the population. Kindly, we need a way forward due to this big challenge. I also suggest that our partners should greatly support male forums so that they are given education and information so that they own and become part of key players in making decisions to promote access to contraceptives. Thank you for bringing in very key components of contraceptives. Next one is, persons with disability should not be left out on contraception services. Thank you for that too. Next, and last for now, contraception services, access and uptake should not leave anyone behind, and that includes the sexual minority women who, to a contrary belief, are believed not to need the contraceptive care. There is need to increase knowledge on sexual minority women and spectrum of sexual orientation. Hashtag leave no one behind. Thank you.
Thank you, Dr. Stella, and thank you to our online community and colleagues. Actually, we've had also questions on the issue of people living with disability and RH, but unfortunately, you've not shown up, so we will not ask those questions. I want to welcome Dr. Mulwa to give us a wrap-up of this panel discussion, and thereafter invite Dr. Ndwiga for his vote of thanks, and then we conclude on the process. Asante. Karibu Daktari.
Thank you very much, Dr. Bashir, and our distinguished panelists for subject well executed. I think we have gotten insights into the various issues under discussion, drawing from your experiences and your various expertises to make the conversation on contraceptives a perspective. I think starting with Dr. Mohammed Sheikh, we have a clear picture that though we have progressively continued to invest in health, it is important that we scale up the investment, aiming to attain the Abuja declaration of 15%. Then you also gave us the constitutional background on investment in family planning and reproductive health, and the journey to self-financing or self-reliability, self-sustainability of the FP program in Kenya by 2024, and therefore also brought the issue of being innovative, which simply means we may not have the resources that we have or that we require in the immediate to meet all the needs, but we can be able to create efficiencies in our system to gain more with the limited resources that we have. Dr. Maureen Baker brought the issue of the central role that technology is playing, especially with 75% of our population being young people, who, if you call them for a meeting like today, in a forum like this, you are unlikely to get them. But if you give them online platforms to participate, you are likely to get them. So ICT will play a role, and the Ministry of ICT's agenda to expand access to network is also appreciated. Then the issue of regulation, so that the ICT space is safe for our children and young people. Issues of cyberbullying and all do not occur, is also well noted. Dr. Mbai has raised the issue of end-to-end visibility of the supply chain, which is something that would require ICT again to ensure that commodities, both at the level of the county where they are required and at the national stocks, and this should actually be both ways, so that even as counties are able to see what is in the national stores, we are also able to see what is in the counties. And you also brought up the issue of counties being more responsive in terms of ensuring that whatever is owed to KEMSA is paid in good time, because though family planning commodities, contraceptives, are provided free of charge, sometimes it is a challenge. And I've been to several counties and I've worked in the county space, and I know that when a county has a debt with KEMSA, they are likely to order these drawdown commodities, including family planning, because that may be an opportunity to remind KEMSA that they have a pending bill. So I think you spoke well about that. That's an issue, that conversation that has been ongoing. And our cabinet secretary is leading a negotiation with the Council of Governors to ensure that that system, where money has to move from the national government to counties, then back to county, then ask ourselves, is this even necessary? Can we just agree that County X, your budget for commodities is 150 million. On a quarterly basis, the national government will wire a quarter of that fund to KEMSA directly, so that you are able to access and you don't face. This is a conversation, high-level conversation that is ongoing, and I hope we'll be able to sort some of those issues. Dr. Mbai spoke very passionately about the issue of teenage pregnancies, drawing our attention to the realities of the experiences that he has had in Murang'a. And this, like Bishop has said as well, is an issue that will require multi-sectoral approach. It is not a one institution approach. It's not a health issue. It's a whole society approach that I think going forward, like Bishop said, is a question of the snake is already in the house. It's how we kill the snake, then we ask ourselves questions later. So we already have a challenge, and it is now us to address the challenge. Then now, for posterity, we ask ourselves, how do we make it better? So the Bishop has outlined the role of the interreligious, of the religious sector, and of course, bring out an issue that indeed it is true the religious leaders of today are more informed, and they are playing a critical roles in messaging of the congregation, giving safe spaces, and also conducting research, and are involved in shepherding and influencing policies and legislations, and as well calling people or masses to action. That is, I think, a wrap-up of the wonderful discussions that we have had. But we also note that our online constituency has been following, and have also raised very critical issues of capacity building of our service providers, so that they may be able to provide all the services that are required near the people who require them, and the issue of policy on contraceptives for adolescents has not been resolved. I think this is a discussion that we have had, and in the policy that we are developing on family planning, I hope that will be able to get addressed forthwith. The involvement of males is also critical, and people living with disabilities has been mentioned, and also sexual minority women to be included in this conversation. That is what I was able to pick, and I want to believe our rapporteurs have picked more, but that is a summary of the wonderful work that has been done by the team led by our CS, Madam Maureen Baka, Bishop Warari, Dr. Joseph Mbai, and Dr. Sheikh Mohamed. Naomba jameni tuwapigieni makofi kwa kazi mzuri. When I was growing up, Ukambani had a supremo in the name of Mulu Mutisia, and I had an opportunity of reading newspapers for him when he lost his sight in 1990s. So makofi tulikuwa tunapiga akanu 1 2 3. Thank you. Asanteni. It's now, I think we have done very well. Thank you very much, Bishop. I think as I made remarks when we were starting, it was very difficult to convene this on a Sunday, because Sundays are usually times that we spend with our families, time for us, a lot of us, to worship and do other things that would not get attention during the week. But we are gracious and grateful that all of you have been able to grace this occasion. And to put it in better words, I will invite Dr. Albert Dwiga to give a vote of thanks and conclude the program. Asanteni, God bless you.
Thank you very much, Dr. Mulwa, for the invite. Chief guest, Dr. Rashid Aman, CS, Ministry of Health. CS, ICT, Madam Maureen Baka. Chair, CEC Caucus, Dr. Joseph Mbai. Director General, NCPD, Dr. Sheikh Mohamed. Director of Medical Services, Promotive Preventive, Dr. Andrew Mulwa. Development partners represented here, implementing partners who are here, colleagues, invited guests, ladies and gentlemen, good afternoon. Good afternoon once again. I can hear you now. Mine is to thank our chief guest tremendously for finding time on a Sunday, no less, to join us today in this celebration. Although he is not with us here, I want him to know that we appreciate greatly for him coming. I want to thank Madam Maureen Baka. Thank you very, very much for making time to be with us here and grace the occasion and be part of the panel. We appreciate a great deal. Thank you very much. The panelists, Bishop, thank you so much. My friend, Dr. Mbai, we appreciate you. Dr. Sheikh Mohamed, wonderful job. Thank you very much. Barikiwa sana. All our speakers who have enriched our afternoon and morning this day. My friend Sam Mulianga, I see you looking very sharp. Thank you very much for your remarks. The professor who has taught everybody here, Professor Gishangi, asante sana, barikiwa. Baka neighbors wahame. Baya, Mid-Red Peter, thank you very much for being with us today and making remarks. Dr. Aziz, I see you at the corner. You stand out. Thank you very much. Lillian Mutia, thank you for joining us, and the USA team, barikiwe. I want to thank also the organizers of this event, Margaret Mwaila, Estella Waigolo, and your committee members. We know you're burning the midnight oil to put these pieces together. Mmefanya kazi poa. Pat yourself on the back. Thank you very much. Mmefanya kazi mzuri, mbarikiwe. the partners who have helped us in cash and in kind for us to be able to meet here. Thank you. Na mahali imetoka iongezewe maradufu so that we can continue collaborating even at the level of service delivery. For the states, thank you for getting the word out. We have reached a lot of people today because of you, and we appreciate it very much. Even after this, keep telling them that COVID or no COVID, we are not, maybe we should say it together, we are not, yeah, we are all pulling together. We are not leaving anyone behind. And we are working towards make sure that COVID-19 is not a barrier to expanding service delivery. All the people who have attended this occasion, this solemn occasion, whether you are here physically or you are here virtually, tunasema asante sana. As I finish, I want to thank the management and the staff of this fine establishment for the nice facility they have offered us. We've not had a blackout like we've had in some other places. So thank you very much for your hospitality. Finally, I would like to thank all the citizens of this good republic who have given us a golden opportunity to serve them, to give them services, and they have accepted us in that role, especially in the role of contraception. We thank you, and we promise you that we will work very, very hard to ensure none of the Kenyans who need this service is left behind. So thank you all, and may God bless you. And as we finalize, I'll ask you to be upstanding for a final word of prayer from Bishop Warari, and thereafter we'll have the national anthem and that of the East African community, and I'll then tell you what we do after that. Thank you very much, everyone.
Thank you again. Shall we bow our heads in prayer? Our Father and our God, our Creator, again we stand in your presence. We pause in meditation. Lord, we stand in awesome wonder, seeing what, Lord, you have done to us. You created us, you gave us a purpose, and you put us here in this world so that we can make this world a better place. And it is your Son Jesus who gave us this golden rule that you do unto others what you would want them to do to you. Thank you for the gift of life. Thank you, Lord, because you have showered us with all good things. You have given us talents. You have given us skills. You have given us time, and Lord, you have given us your very presence because we are not walking alone. Thank you for the success of this meeting and forum. All the good things that were said, all the research that has been done. Indeed, like we've heard, that there are those who did the donkey work. They burnt the midnight oil so that this meeting can be a success. We thank you. Lord, you who said that we should take care of those who are weak, those who are disadvantaged, we bring to you our mothers and our children, that from now on we are not going to leave anyone behind. We are also going to go to those people who have been controversial, those people who are the very people who act contrary to your will. we will not leave them behind. We'd want to go back to them and for them so that we can gently show them the need to love your creation and to take care of your creation. The task that you have given to each one of us, we pray that by your grace and divine enablement, each one of us will do our small part. And having done it, we will look back and give you all the glory, because we shall cross the river together. We shall get into the land of abundance and joy and health, according to the Epistle of John chapter 3, where the scriptures says that it's your will and desire that each one of us may prosper. Prosper in every way, in knowledge, in good health, in provisions, in living a fulfilled life. We pray that it shall be done. Thank you for our brothers and sisters who had this vision, and this vision is being fulfilled in our generation. Lord, as we part, as we pray that you begin with us, we pray that you go with us. Some will travel far, others will go near. May the blood of your Son cover us round about. May you keep us so that next time when we meet to review, to deliberate further, we will rejoice under the shadow of you, our Most High God. As we dismiss, we ask that you dismiss us now with your grace and manifold blessings, in the name of God the Father, God the Son, and God the Holy Spirit. Amen.